This is the Purple Passion Project with host and clinical sexologist, Dr. Stacy Friedman. This is your go-to podcast for raw, real, and irresistibly juicy conversations about sex, intimacy, connection, and everything in between. Whether you're feeling a little stuck in your love life, curious about what turns you on, or just craving conversations that actually matter, you're in the right place. So now, please welcome the host of the Purple Passion Project, Dr. Stacy Friedman.
What do you get when you mix purple, passion, and permission to be your true self? This podcast. Hello, I'm your host, Dr. Stacy, and this is the Purple Passion Project, coming to you live and unfiltered. This is the show where we talk sex, intimacy, connection, and everything underneath the surface. So let's be honest, small talk is boring, and you're ready for the good stuff. So relax, drop your guard, get ready for some truth, laughs, maybe a few guests, especially today. We have a great show and a whole lot of passion. Today, we are diving into a topic that is rarely discussed openly, but it deeply affects many men, especially in my practice. I have a lot of men that reach out for some support, and we are talking about male enhancement. So joining me today is Dan Salas, the CEO of Surgery Life Enhancement, also known as SLE, with over 30 years of experience in both surgical and natural enhancement methods. Dan's mission is to help men boost their confidence to reclaim their power. He's been featured in BBC documentaries and even made an appearance at the iconic Playboy Mansion, which I'd love to hear about. This episode promises to be educational, intimate, and absolutely empowering. So men, listen up, let's get into it. And I'm going to bring on Dan. Hello.
How you doing?
Good, good. Thank you so much for being here. I know this is going to be a subject that a lot of people are going to tune into.
Let's hope so. Yeah, I'd like to reach out to as many men that feel this way and see what I can do to help.
Absolutely. Well, I'm glad you're here because I think that this is a subject, like I had mentioned, I hear about in my practice all the time, insecurities and issues that men have about their privates. And I think it's just an important thing to be able to talk about because not enough people talk about it. And so what actually got you inspired to be into this field of male enhancement?
Well, I think it goes way back to when I was about 11 years old, and I started developing thoughts of, I knew I was going into puberty, and I noticed my friends changing in their voices were becoming deeper, and in the locker room, I'm from the 70s, so in early 80s there was no courtesy stalls, so everybody can see.
Just naked.
Yeah, you go to school, you go to the gym class, and back then we had to shower, and everybody could see your penis. And I just remember comparing myself to other friends of mine that were already fully developed or were born. A lot of people don't realize that you're born. It's in the womb when you're developing. That's when your size is determined. And so I was feeling guilty for being so small but after realizing that that's what I was born with and I was not going to get any bigger, I had to do something. I couldn't live the rest of my life with the same size penis. So I did everything I could to change that and to enlarge my size.
Yeah, and it's unfortunate that there has to be, especially for men, that's such a stigma that if you're not a certain size, that it's not good enough. And for you at that young age to feel that being in the locker rooms, it can be intimidating and cause insecurity.
It was traumatizing.
Yeah.
Because there's different levels of insecurities. So you have guys that care, but it's not a bit, they're more like, hey, I'd rather have a nicer car. I'd rather have, the other things took priority. My priority 1, 2, 3, 4, and 5, like everything, 24 hours a day it was either in my conscious or my subconscious, and I stressed about it and thought about it and obsessed about it all day long, and I didn't know why. I just I couldn't stop thinking about it, and everything I did in life, the pants couldn't be too tight because it would show my bulge or with a lack of bulge, to not dating this girl because I know she had been with someone that, just
Everything.
everything to the where I friends I had. It completely molded my life, and
It
and I
consumed you.
and I did not want to go on. I realized that at a very young age that I did not want to live like that forever. I wanted to be free, and so I went ahead and had it done.
Okay, so this is what you kind of have dedicated your life to, and I know
Yes.
that some people have some misconceptions about what exactly it is, male enhancement. Why do you think it's so taboo? Why do you feel that people still are afraid to talk about male
Yeah,
enhancement?
that's really, I know it bums me out because when women have breast augmentations,
Exactly.
they announce it. I went to my consultation. I think I found the right, you can talk about it
There's no
openly with
shame. You
no
shouldn't
shame,
have shame,
zero
right?
shame. But with men, there's still shame.
Right.
It's still a taboo. It's still a very private, very, you if majority of the men that have it done, I would say 99% of the men that have it done, nobody knows. It's maybe just their wives, but the friends at work, I wouldn't even recommend it because you're you're going to be talked about. You got to expect
Right.
that people are not going to understand and use it to goof on you, and he had, and then when you're not at work or whatever. I mean, it's just the society. We're still
Society.
30 years in the dark in terms of men.
Right.
Not women. Not, I mean, it's frustrating.
Yeah, and I understand because even as a sex coach and a sexologist, I'm helping people improve in their relationships, improve in their in their bedrooms. And it's very difficult sometimes referral wise, unless it's from a therapist, because I could do so well with working with a couple. But if they have to go and say, oh, we're having problems in the bedroom, we went to go see Dr. Stacy and she helped us. No one wants to, people are so filled with shame to share that they're having a problem in the bedroom, that they're not comfortable with the lips hanging on their vagina, the size of their penis, the size of their, I mean, we're all beautiful how we were born. And it's so
Right.
sad that we have to have so much shame. And especially when it comes to the male penis, is because I hear all the time that, I'm afraid to go out dating. I'm afraid to let anybody see me. And unfortunately, women need to be a little bit more kind as well when they do get to a situation where it may be something unexpected or a little smaller than they want or something like that, because we have to look at what does that mean? So maybe you don't feel as tight when you're in there. We have toys, we have things that we can use. It's about connection. It's about, the love a lot of times. And so if we can just understand that people are just born different, we wouldn't have what you grew up with that shame and that feeling, you
Well,
know?
yes. No, I mean, at my age now, it means a total different thing
Right.
as opposed to when I was
Growing up.
16, 17. I was just, I was a typical young man
Yeah.
wanting to have different sexual experiences, and that's all we talked about in high school, or you know what I mean. And
Yeah.
but yeah, and so,
Understandable.
but yeah, when you get to this point, at least in my stage in my life, love, body parts and stuff don't really matter. I always use this analogy. I have a 36-year-old daughter, and I've met, throughout her lifetime, I've met some of her boyfriends, and never did I think, man, I hope he has a big one. I hope he's hung. Like, you know what I mean? Like, that's not
Right.
something when you truly love, but
Right.
it's as a man that feels inadequate or feels like he was, below average. It's something that you really can't. You can't, if you can't accept it, you feel like you're not complete.
Right.
So the only thing I can really say that changed my life, because once I got to where I wanted to be, I quit thinking about it. because I felt complete. It's almost
Right.
like one of your arms is shorter than the other, and it's obvious, and people can see it, or you can, or it's you have one arm shorter than the other, and so it felt like both my arms were finally. I felt complete.
So now you
That's
have
all I
3
can really
arms instead of 2, right?
well,
Or
three
is that
legs.
legs? 3
That's the
legs.
third leg. 3 legs. Yeah, yeah, yeah. But
Well, I mean, it's the same thing with women with their chest. If they have like a size A and they feel like a little boy versus a woman, and they want to do that. Everyone has some type of insecurity, and if you
or
found
one hangs lower than the
right,
other, right?
which is
Yeah.
normal, right, which is normal. So share maybe a story of someone whose life might have been besides yours, who that has been changed by some of these procedures.
Well, one that stands out. I mean, there's so many. I've been doing this
Right.
30 years, right? So
That's it.
the it's been 24, and I'm 55, so yeah, 31,
That's
20,
amazing.
30, 31 years. I started in 1994, and it was really just for myself. It wasn't. I never dreamed that I would be doing this, but I love my job,
I'm
or
sure.
I love what I do. It's not a job; it's just a passion of mine. But I remember I had a gentleman come in and said he could not. He was small. We did an examination on him, and he said, Dan, I can't keep a condom on. And you can see even the. I'm sure there's something out there, but the condoms that you buy at the pharmacy
Our
wouldn't
average.
stay on. And so we went ahead and moved forward with his procedures and assisted. Took about a 6 to year long process, but he had the procedures, and now he can use a condom, and it's that's a health and
That's huge.
safety. That's a safety health
Right.
issue there when you can't even wear a condom because you're so small.
Yeah.
So you know what I mean. I remember he came when he finally we he came in and showed us that he can keep a condom on, and he started crying. So
I'm sure that was emotional.
very emotional time, and so that we all kind of cried and hugged
Oh, I
him,
got
and
goosebumps.
yeah, well, it was really it
It
felt
changes lives.
it changes lives. Uh, Another one is where men, I'm sorry, when you have children, sometimes, and I'm talking this as a partnership now, right? Not just an individual choice, where when you have children, things aren't the same down there for your partner, and sometimes that can be an issue in the bedroom. So we have guys that call and ask to have the procedure, and then they call and say, yeah, everything's kind of back to where it was pre children.
Children.
No, so it's there's. I mean, I can go on and on, use different examples, but there's men out there that want this so bad and just don't know who to reach out to. My advice is just reach out to somebody. If there's so many,
Even just to talk about it and try
yes,
to get, I have people coming to me all the time just to try to talk through and help change that mindset. And where I can offer things like, oh, well, maybe you can use some type of a toy cover, or, a sheath for the penis, or this or that, where they could actually find someone that may be able to do more, which we'll talk about as we get into the next
okay.
segment. But what I want to hear a little bit about the Playboy Mansion. What was that like?
Well, okay, so it was early on when I started my career as I call myself a coach, because I help guys in I do help in surgery and pre-op, but my expertise, if you will, is more in the aftercare. Like once you've had the surgery, that's when I really and so I went on the show. It was Playboy Radio, and they one of the things we do at the end of the show is I go in. I have a bowling ball. It's actually I have a video. I'll send it to you.
Okay.
Right. I have a stretching component, and I attach a bowling ball on it. And so the host at the Playboy Radio asked if I can come up, step up and put the bowling ball on and my stretcher. And I started swinging the bowling ball, right? And they were all just like mouths dropped, right? Like, oh my God, this this guy's got a bowling ball on his penis, and they said get Hugh down here, get Hugh,
Right.
and he comes in, walks in with like 7 beautiful blondes,
Uh-huh.
and he just looked at me swinging the bowling ball. He goes, "Well, I thought I've seen it all. Wow!" And he just walked. He made a short appearance. He was only in there for a minute, but he
Right.
said he looked at me and said, "Oh wow,
I got some
I thought I've
competition
seen it
going
all
on.
at this stage in my life." But okay, you
That's
learn something
great.
new every day. So that
That's
was
awesome.
pretty interesting.
That's awesome. Well, I want to talk a little bit about what you do and the safety and just everything behind male enhancement and the science of it. And you talk a little bit about PMMA. So I want to put up something on the screen for people who can see that kind of explains what the PMMA, oops, wrong one. Sorry.
Yeah.
That one, there we go. So that way people can see what it is, but give us a little idea of how it works to enhance girth.
Okay, well, this is a filler. A lot of people think of fillers, well, Botox, right? So let's just, for example, say it's like Botox, but it looks more like toothpaste, right? It behaves like toothpaste, so it goes in, and we inject it in the right behind the glands.
And that's
The
the
head.
needles I put up on the picture there?
Those are it. Those are see, that's what it looks like. It almost looks like toothpaste or
Yeah.
conditioner, right? But it's a filler that has a microsphere suspended in the filler, and it's in where it. Yeah, I also want to mention that it's not just penis related. I know we're talking about the penis, but you can inject PMA anywhere.
Okay.
But we inject it in the shaft of the penis, and it tricks your body to see when your body is not rejecting something, it will encapsulate it,
Okay.
right? It's called capsular contraption. So what happens is when we put this filler in with all these microspheres are being encapsulated by your own body and creating connective tissue, blood supply. It's your own body creating new tissue, and
So
so
is it
the
permanent, that area?
permanent, yes, PMMA is permanent. It's a permanent solution
Wow.
to somebody that feels he's that's would like a little more girth, a little more thickness, which is underrated because I think girth is just as important as length when it comes to sexual intercourse or
Yeah,
just.
you're filling up the space a little bit better.
Yes, that's what I've been told.
Yeah, that's great. That's
Yeah.
great. And as far as like safety wise, is there any risks, like, or if there are, what kind of risks are there?
We have PMMA. My technique was very risky. They took skin grafts from my back, but that was back in the 90s. With PMMA, it's very safe.
Okay.
I mean, maybe we don't have many complications with PMMA, but I would say maybe 95% success rate. Every
Wow.
now and then we do have some complications, but I don't know. Maybe it could be someone's lifestyle. Sometimes patients.
I mean, things happen anytime you're doing any procedure.
Exactly.
Something can
Yeah.
happen.
If a doctor tells you he's never had any complications, run.
Right.
He's lying to you.
Right.
Okay, because even your local dentist down the street, everybody had all medical professionals have had complications, but this is very, very safe.
How's the
It's
recovery?
2 to 3 weeks, and you're back on track. You're just back to normal. We don't recommend having intercourse for about 6 weeks, but yeah,
Oh, they're not going to like you.
no, they don't.
No,
They
I'm
don't.
just kidding, because they probably will like you because they'll like the
Yeah,
results
the, the
afterwards.
doctor's the one that gives the bad news, but then they always look at me and go, "Are you really, Dan? 6 weeks?" They go, "Yeah, 6 weeks."
Hey, listen, when women have babies, we're supposed to wait preferably 6 to 12 weeks, depending on if it's a C-section, a regular delivery, vaginal delivery. So sometimes we have to wait a little bit, but that doesn't mean we can't fool around, right? Or does it mean that they just can't have an erection? Or
Right, because well, I mean,
to avoid the erection.
yeah, and
Okay,
that's yes.
got
Avoid
it.
the erection, because the intercourse, obviously, there's pressure, there's things that they're out of your control because it's just something that it's natural and it takes over, and you're not necessarily thinking about taking care of what you just had done.
Right.
You're just happy that it's thicker, and so just wait the 6 weeks and listen to the doctor, and you'll be fine.
Right.
Yeah.
And you were also talking about there's something else with the dermal filler or something. The
The dermal graft is a technique that was used in the 90s and early 2000s, but now everything's switched over to PMMA. You don't really see anybody using the old techniques because they're very invasive, and they're a lot more risky in terms of infection and complications.
You were talking about the hydraulic. Was it the hydraulic acid?
Yes, that
What
is
I wanted to show this also.
no,
This
yeah.
one right there. And this is something that you use as well?
We use that as a temporary filler because, sometimes patients they want to see if they're going to like the permanent
Oh,
solution.
so this is temporary.
Temporary, and so you get the same effects, but it's just like Botox, right? Where it fills the area, but over the course of times it tends to reabsorb, and you've got to come back and have it redone. So what a lot of guys are doing is they're having hyaluronic acid and say, yes, I actually do I appreciate the girth and the change in my penis. Let's go permanent. And then so the next time they come, we use the permanent PMA, applying the same technique that we used with the hyaluronic acid.
Awesome. Awesome. And all this stuff, I'm sure, helps. The enhancement helps with performance anxiety and insecurities that men may have just because they're feeling better about how they look and how they feel.
Yes, and it is real. It's I can speak from personal experience that I didn't tell when I had my procedure done. I didn't tell anybody, not even my sexual partners. And
now you're telling the whole world.
Huh? What's that?
Now you're telling the whole world.
Sorry, Mom. I hope you're not watching. But yes, and so yeah, everybody knows now. But at that time, I didn't say a word, and I was noticing that women were achieving orgasm where I didn't experience that before. I'm only speaking from personal experience.
Right.
I always wondered, like, wow, I could never. My girlfriend could never reach orgasm through sexual intercourse, and after my procedure, it was just one,
Right.
Yeah.
and that could be variable. It could be.
We're reaching that.
We're going there. But sometimes, the fact that you might be filling her up more and being able to reach different areas a little bit better can definitely help. It's not going to hurt.
It doesn't.
It's not going to hurt.
Just a little, just a little bit. But yeah, eventually, you get.
Awesome.
That has been my experience.
This is great. I'm going to just take a quick little commercial break, and then we'll be right back to finish talking with Dan.
Looking to reignite passion, deepen intimacy, or overcome challenges in your sex life? Meet Dr. Stacy Friedman, a clinical sexologist and certified sex coach with over 20 years of medical and coaching experience, dedicated to helping individuals and couples build more connected, confident, and satisfying intimate lives. From performance anxiety and desire mismatch to communication struggles and curiosity about pleasure and identity, Dr. Stacy creates a safe, judgment-free space for real transformation. Her unique blend of medical insight and compassionate coaching welcomes all, whether you're single, partnered, poly, queer, straight, exploring, or rediscovering yourself. Through one-to-one coaching, she helps clients explore their desires, break through barriers, and embrace a more empowered sexual self. And the best part? She offers a complimentary 15-minute consultation to ensure it's the right fit. Visit drstacyfriedman.com to schedule your free call today. Dr. Stacy Friedman, where her passion is to help you create yours.
I cut myself off too quick when I put the commercial on. I was in the middle of saying something. So anyway, we are back with Dan talking about male enhancement and all the great things that he could do to help and how it could definitely improve insecurities and performance anxiety and things like that. So is something like this cost effective for people to get? What is this accessible to many men?
Yeah, yes, it is. When I had my procedure, they charged me $8,500, which is pretty pricey for early, back in 1994. But now with PMMA, and we figured out how to cut down the costs to make it more affordable for anybody. Packages start at $2,600, all the way up to $10,000, and $10,000 is sometimes including body parts, and some guys do their calves and their penis, or their chest or their biceps and their penis. You can couple a lot of other areas or parts of your body, but
that's interesting. I saw the video that you had sent me, and it showed a calf injection because someone had a smaller calf than the other one. So this could be used for other purposes.
Yeah, he's actually a New York firefighter and damaged his back, and the nerves, I think he explained in the video, the nerves atrophied his calves. And so we used PMMA because it's just, well, look at it like a big penis, right?
Right.
And that's
a big one.
Yeah, that's a very big calf. Yeah. And so we just applied the same principles to the application on his calf. But yeah, so you can place it anywhere, and obviously we're men and we want it in our we want to enhance ourselves.
That's number one. That is number one.
Number one is the penis, yeah. But it can be applied anywhere. Bodybuilders are putting it in their shoulders and chest. It's really it's very interesting.
How do you help men decide what procedure is right for them? Because it sounds like there's so many different things. You just kind of have a conversation and see what they need and figure out what works.
Yeah, we have, there's guys that are really long and they are very thin, right? So
they need more girth.
And I say, hey, well, what, if you can choose one, what would you like to do? And they said, my girth bother. I'm happy with my length, but I would like more girth. And so, okay. So they tell me what they want, what their wishes are. And we just kind of go from there.
Right. Well, speaking with so many people around the world hearing us, and I'm sure there's some men that are listening that are thinking to themselves, this would actually be really cool. And, if you have somebody that's listening, but they have such either insecurity or they're too embarrassed or they're feeling shame, what would you tell them to do to feel that confidence to at least reach out and try to get that support?
Well, I would say, well, call me. Call me. I can help you.
You understand.
I'm being completely honest, Dr. Stacy. I get calls from all over the world. And if you're in Florida, I'll recommend a clinic in Florida or in New York. There's other clinics. I'm not on here going, we're the only ones, we're the best in the world. No.
Right.
But go somewhere where you feel comfortable. And if it's us, I'll be happy to help you through the process. That's really my job, is to make you feel comfortable that you're not alone. And there's a lot of other clinics out there that I recommend if you want to stay close to home and not travel all the way to the West Coast. So but yeah, I mean, there's counseling, but the counselors are not really going to understand. Call me. Just call me. I don't know but call Dr. Stacy, call me. We get it.
Right.
Okay? We understand.
And I think that the fact that working with somebody who has been through it, who has experienced it, I know even as a sexologist, there's so many things that I've experienced sexually and intimately that I could relate to. I had painful sex for 6 years. And so one of my specialties is working with women who have dealt with painful sex because I've been there. I understand the pain, the trauma, the sadness. And so when you find someone that's relatable,
Right.
make
Right.
all the difference. So when you have someone that's maybe listening that's insecure or is embarrassed, talk to somebody who knows, and you're definitely one of those people. So
And really quick, Dr. State, I'm 55 years old. Okay. When you get to this point, you're not thinking like a young kid anymore. You're
no,
thinking
you want to just help people.
retirement. Yes, you want to leave something behind. And so what I'm hoping to do is create as many Dan Salases as possible before I leave this earth, to create as many guys like me, and so the support continues long after I'm
That's
gone,
awesome.
and bringing that out of the shadows. Just enough. And
Yeah.
when somebody can say, if a man can say, I'm a woman and we have to respect that, then a man can say, look, I feel, I need a little help in that, and he shouldn't be made fun of, or
No,
have the finger pointed at him, when there's all kinds of different,
we need to normalize it.
we
We
need to
need to
normalize it.
normalize it.
Yes, and that's my goal. I'm not looking for fame, or I just want to help as many men as I can, and create as many opportunities as I can for people that feel this way. Then the ones that feel they're out there. If you look at me, it consumed everything aspect
Yeah.
of my life. I couldn't stop thinking about it. If that's something that, if you're like me, I get it, and so I'm trying to create as much. Like I said, one day I could, a gym, or somewhere where men can go, and like there's a big conference of other men that feel the same way. I don't know. I really don't know what, but I'm trying. I'm trying to make
That's, I
it
mean, that's the way you're bringing it
more
mainstream.
accessible.
Just getting out there and talking about it. And that's why I'm doing this podcast, is just to be able to get all these different subjects that are either taboo or that people are ashamed or embarrassed to talk about, to bring it into your home so people can listen to it in the privacy of their own space, to be able to be like, okay, I'm relating. This makes sense to me. And so I'm glad that we're able to do this with you. And I know that these procedures, or just the positivity that these people are going to feel, will, I'm sure, affect and impact their relationships, their intimacy. How did you feel that it affected you? I mean, it made a huge change, right?
Oh yeah, yes.
Besides the orgasm, besides the women's orgasm. But I definitely see how it could help with that confidence.
Yeah, well, I guess I could, as I mentioned earlier, you have a sense of completeness. Like, okay, this is what I felt I should have been born with, right?
Right.
And so when you're walking, before I had the procedure, walking into the bedroom, I was always nervous, performance
That's all you're
anxiety.
thinking about.
Yeah, it's like, oh my God, and when she sees it, is she gonna think it's small? Those aren't the thoughts you should have when you're about to go have.
You want to walk in with your chest out, with your shoulders
I
back, and be
can't
like,
wait.
I am the stud.
I can't wait. Yes, that's
Wait
what
till
you
I
want
give
to
you
feel.
those orgasms.
Yes.
Yeah.
Yes.
Yeah.
Yes.
That's
Yes.
awesome.
And it's a beautiful thing. There's nothing wrong with it.
Right.
Anybody that's ever had, this is a sex show. So when you can climax with your partner at the same exact time, it's oh my, the fireworks are going off in your head. It just exploded. It's a
Well, I'll
feeling
tell
you
you.
can't, right? Am I right or am I wrong, doctor?
Yes, but I want to make sure that I put this disclaimer in,
Okay.
that 80% of women do not orgasm through intercourse.
Right.
So if we are still having intercourse, we could use our hands, we could use toys, we could still orgasm together, but we may need a little extra assistance.
That's true, and that's where you
So
come in, because you're
just have to put a disclaimer.
Yes.
But yes, I mean, if it feels better and it fills you up more and you're able to reach more areas, you have a much better chance, and it's going to feel that much better. So,
Oh wow, it's
awesome.
amazing. Yeah.
Awesome.
So that's one of the benefits, one of the fringe benefits of enhancing yourself.
Very, very cool. Very cool. So we got one more commercial, and then we'll come back and we'll finish up chatting, and we'll get some more details.
Okay.
All right, I'm not going to cut myself off this time.
Oh, okay. So we're in commercial right now?
We are going now.
Okay.
Looking to spice things up in the bedroom? Dr. Stacy's got you covered. From luxurious lotions to silky lubes and tantalizing toys, our collection has everything you need to turn up the heat and reignite that spark. Whether you're flying solo or with a partner, our products are designed to enhance intimacy and pleasure. Use the coupon code PURPLE and get 20% off your entire order. Visit drstacyfriedman.com, click the shop link, and explore our full range of goodies that are sure to bring out the fun in the bedroom. Let's make every moment more exciting. Dr. Stacy's Tantric Toys, where pleasure meets purpose.
We are back. So we were talking a little bit about, masculinity and how these types of procedures can help address the issues of the insecurities and all that kind of stuff. So doing this, I feel that men can show up more powerfully, more aligned in their relationships. And it's not just even, like you said, it's not just even the penis thing. It's doing other things such as the calf, such as this, such as that. So what are some ways that you see addressing these are bringing men to show up better in relationships? Is it just confidence?
Yes, it's confidence, because you have it now, or you are where you've always wanted to be, and so the confidence is there, and it just you give yourself doors where doors would open in the past and you wouldn't go through them. You now have the confidence to go through those doors. So it's something that it's a life changer if it's important to you, it's important. So when you have it done, it does change your life.
I think one thing that's important also, is not only just for the men, but for their partners. And I'm talking about women specifically, that women need to understand that just as much as women may have insecurities about their breast size, their butt, their lips, vaginal lips, their bodies, whatever, we have to understand also that, society puts so much pressure on men to be masculine and to be big and large and all this kind of stuff. And we need to just get rid of that thought process and be able to allow men to just be who they are, just like we want women to be who they are. I think that by allowing and allowing a man to just come in, and if you see something that might be a little different or whatever, to treat them how you would want to be treated as well.
Yes. But when a woman can treat a man like a king, but if he's not secure with himself until he fixes what he feels needs to be fixed, right. It's something that it's internal. It's a journey that you need to go on your own and figure out, and then then maybe you can come back and feel like you can have a meaningful relationship. It was tough for me. When you're not happy, it's tough to have a healthy relationship when there's something wrong with you. Not wrong, but something it's in your mind.
No, it's shame, and shame is like a narcissist in your body. It just takes over, and it's like almost like your nervous system is reacting to that constant of your body's like berating itself.
And one thing I've noticed, Dr. At my age, I still try to go to the gym, and one of the things I notice is women are about 90% of the women in the gym are working out their butt, right? I don't know if the squats and the it's a very, I've noticed that. And with us, if we could I always say, imagine if we can enlarge our penises. If there was a gym where we went and helped each other, just help each other enlarge our penises, and got the information and what type of equipment works and what doesn't work, and that I wish there was something like that where men can go and get help.
Well, hopefully after hearing the show and just having, first of all, women, because one of the men that I had worked with actually said to me when he was having issues with his size, when he told me his size, I was like, well, that's very, very average. There's nothing, but he said that there was one experience where she was with someone before him that was a lot larger. When she was with this one person, said something because I think she was mad at him. And they had broken up. And ever since then, he's had this complex about size. So that's why I say that even you just don't realize sometimes that effect it could have, where it could be a lifelong struggle when it could be completely normal. But having people like you out there that have the ability to help is great to know.
Yeah, it is. It is tough to hear when your partner, your girl tells you, I've been with someone bigger. But I love you, honey. No, we don't. We're not hearing that part. We're like, how big was he?
Right.
Pull out the pen and paper.
The measuring stick.
Can you show me exactly? And then
and then you go to you and you say, you see this ruler? This is how big I want to be.
Yes. And I know. Yeah.
So if you had a message for the men out there, what is one message that you want men to know about their bodies? That you think could resonate with them?
Well, I mean, we're talking about the penis. So my message is, if you refuse to settle for living the rest of your life, you think about it, the rest of your life with the same size penis, and you're not happy, do something about it. Don't live like that forever. I know.
Get it out of your head.
Get it out. Just once you change that part and you get it to the point where you feel like, okay, this is where I always felt I should have been, from the very beginning or when I developed, for those things are no longer in your mind, and you can move on with your life, and just, there's going to be other things, other challenges, but having a small penis will no longer be at the forefront of your thoughts, and you can just kind of move on and be happy.
On and have a good relationship.
I'm happy. I have problems, doctor, but I'm very, down there, I'm very happy. I feel like, thank God I
like born again.
It's like being born again. Yes.
Right. Well, I want people to be able to find you. I know that you have your WhatsApp information over there. I'm going to just make it a little larger for people to see. So that way, if they do want to reach out to you, they know where to get your information. Is there any other way to reach you? Or if they do call this number, give us some background.
Yeah, well, you can also go on www.surgerylifeenhancement.com. I have pictures, before and after pictures, and we bring you in the surgery room and show you our techniques. We're very transparent as far as that's, the techniques that we use, and I think we can help. But there's, like I said, just get help. Don't live like that. Try to find a source and move forward and with your life. Don't be stuck there. So I've been there. I know what it's like, and it's no fun. No bueno.
No bueno. Not a good place. Not a good place to be in your mind.
No.
I thank you, Dan, so much for joining me and shedding light on such an important and misunderstood topic that I'm sure a lot of men are really happy that they tuned in. To all of our listeners, if today's conversation opened your eyes or touched something personal, remember that confidence is not just cosmetic. It's connected to how we feel, how we love, and how we live. But cosmetic could definitely help.
Yes.
So thank you again very much. And all the information will be in the show notes in case you missed it or can't actually see it and you're just listening to the audio. So Dan, I'm going to say goodbye right now, and we're going to just finish up with the outro here. And it was great talking with you. Thank you so much.
Great speaking with you as well, doctor. Thank you so much.
You're welcome. You're welcome. If you all loved what you heard and you want to hear more and subscribe and you want to go deeper, follow me all over social media at Dr. Stacy Friedman for resources and behind the scenes magic. So until next time, stay curious, stay turned on, and never apologize for wanting more.
This has been the Purple Passion Project with host Dr. Stacy Friedman. Tune in each week as Dr. Stacy breaks down walls, busting myths, and gives you permission to want more with no shame, no filters, and definitely no small talk. Check in every Monday, 7 p.m. Eastern, on your favorite streaming platforms. We look forward to seeing you next time. Be sure to visit drstacyfriedman.com to learn more.